The bright side of addiction is recovery. And recovery begins with hope. Now, if you're new to our podcast, we welcome you. If you've been here before, welcome back. And if you are in recovery, know or love someone who is, or maybe you just want to know more about the recovery process, or maybe you're a bit concerned about someone you know or love who is harmfully using alcohol or any other drug, this is the podcast for you. As we carry the message of hope and the promise of recovery. And a reminder, you can find all of our podcasts at recoverycoasttocoast.org. Recent episodes have featured actor John Larroquette, musician Bonnie Raitt, authors Brene Brown and Anne Lamott, former NFL player Ryan Leaf, and others. All these interviews and more are on our website. Plus, conversations with everyday people in long-term recovery as they share their story, their insight, and their path. Now, in this edition of Recovery Coast to Coast, we're going to sit down with Dr. Joesph Lee. Now, Dr. Lee is the CEO of the Hazleden-Betty Ford Foundation, an outstanding treatment program with a rich history, a powerful, powerful legacy. Ever wonder how Hazleden Treatment Center got its name? Well, here's a quick clip from today's podcast.
We started in 1949 on a farm, and the farm was called Hazel's Den because it belonged to the Power family. They're a prominent family in the Twin Cities area, and one of the owners was Hazel, so they called it Hazel's Den, and that was the name, Hazleden. That's where it came from, on this farm. So to come out of a farm where there's no treatment and to now become what we are. And people ask, why do you do so many things? Why do you have publishing? Why do you do prevention? Why do you have family programs? Why do you have a graduate school? Why do you have a research center? We do it because we're more than a treatment entity. We are a social reform movement.
Our conversation with Dr. Lee coming up in just a matter of minutes. Our website is recoverycoasttocoast.org, and if you would like to help us out financially or know of a foundation or an organization that might be interested in underwriting part of our program, we would be so very grateful. A reminder, our email address is recoverycoasttocoast@comcast.net. We would love to hear from you. Recovery Coast to Coast is supported by Sundown M Ranch. Now, they are one of America's oldest, least expensive, and most successful treatment programs. There are an estimated 25 million people who are living a joyful, gratitude-filled life of recovery. Now, not all of them went through treatment, but many, many have. And close to 200,000 have gone through treatment at Sundown M Ranch. They are designated exclusively for the treatment of addiction and related disorders. They're licensed by the state of Washington, accredited by CARF, which is the Commission on Accreditation of Rehabilitation Facilities. And what's really important, they are a member, in fact, a founding member of NAATP, the National Association of Addiction Treatment Providers, adhering to a strict code of ethics. Now, they're also a not-for-profit organization, and unlike many other treatment programs, Sundown's bottom line is long-term recovery and not financial gain. Residential treatment at Sundown is important because it allows an individual to focus on treatment and healing without any outside distraction in a supportive community environment. And it gives family members an opportunity to participate in their comprehensive family program. And their beautiful location at the entrance to the gorgeous Yakima River Canyon brings about a measure of peace. They're not too far from Seattle, by the way. And Sundown is in network with most commercial insurance companies. Admission specialists can quickly obtain a quote for the patient and work directly with the insurance company so you don't have to. Sundown M Ranch remains one of the most affordable treatment programs in the country, and their staff, which has been together a long time, second to none. Even if you're not looking for treatment right now, check out Sundown M Ranch so that you'll have an understanding and an idea of what they do, who they are, and why they've been so successful for so long. Check out their website for more information. Take a look-see at their facility, and it's sundown.org. Sundown M Ranch, where recovery begins. Well, it's coffee time, at least for me, perhaps for you, as I share an in depth conversation with the CEO of the world famous Hazleden-Betty Ford Foundation's treatment program, Dr. Joesph Lee. Now, our conversation took place at the recent Treatment Leadership Conference presented by NAATP. Here now is my candid conversation with Dr. Joesph Lee. Welcome back once again to NAATP 45. It's the 45th anniversary of the National Association of Addiction Treatment Providers, the National Leadership Conference. I've been fortunate enough to be here so many years, and when I come here, I get a chance to meet new friends and catch up with old friends and talk to some of the real leaders in this field. And one of them is Dr. Joesph Lee. He's the CEO of the Hazleden-Betty Ford Foundation. And I believe he's been CEO now for 3 years at the foundation as captain of the ship. And prior to that, Dr. Lee was medical director at the Betty Ford Youth Continuum, and that was from 2010 to 2021, I believe. Is that correct?
Yep.
Thank you for joining us, first of all, and congratulations on all that the Betty Ford Foundation has done and continues to do. You are an innovator and a visionary, and I salute you, first of all. Tell us a little bit about the life of Dr. Lee. How did you get involved in working in the addictions field?
Well, first, Neil, thank you. I'm just the latest steward of the mission, my team and I
And
are.
a damn good one, I might add.
Well, thank you. But, this is our 75th anniversary,
Yes.
as you know. And there's a lot of important giants that have come before who've set the stage. Mrs. Ford being one of them, but so many people. And a lot of people have laid the foundation so that we can talk about recovery in the way that we do today. And before I begin, I just want to give you some praise too, because yesterday we were at a gala and you just got the Michael Ford Journalism Award.
Yes, thank you.
From NAATP, and it was just a fabulous speech that you gave, your life's work. So thank you also for setting that stage.
Well, it's, we're all in this together, and, it takes a village or a community. And I strongly believe in recovering out loud. And that's what recovery has become. It's out of the church basements, it's into the community, and it's inspirational to people who are still sick and suffering. If so-and-so can do it, maybe I can do it. If Betty Ford can stand up and say that she's in recovery, maybe there is hope for me. And so I believe strongly addiction is an American way of life. And we've grown so much and continue to grow. And under your leadership, we will grow even more. But what brought you to the addiction field, Dr. Lee?
Yeah, I think that sets up a really good contrast, because by contrast, my background story is far less inspirational and interesting. I'm a physician by training. I'm a child psychiatrist, adult psychiatry, also addiction medicine. I do not have a background of personal recovery. I have addiction in my family. I came in through it. Really, my interest in addiction came through my residency training.
Really?
At Duke University. I had heard about addiction, had seen patients go through various stages of substance use disorder treatment. When I was at Duke, my first year, I was working in the emergency room. And when you work in the emergency room, you see all of the negative aspects and the stigmatizing aspects of addiction. People brought in from law enforcement, people who are high or intoxicated at the moment. And you can understand why stigma exists if you only see people in the emergency room for addiction. Interestingly enough, about a year later, I got an opportunity to do a month-long rotation at a place in Greensboro, North Carolina called Fellowship Hall.
Oh, sure.
Yeah.
I'm familiar with it.
Yep. All the residents just raved about it. I saw some of the same patients that were in the emergency room.
Wow.
Yeah. And you see them transformed. And I saw that change, and I was like, wow, this is when you're a physician and you sign up for helping people, this is the kind of transformation you're signing up for. This is what you're looking for. This is the kind of home run. This is the kind of change. And so I just fell in love with that kind of mission. And then from there, I went from North Carolina and I worked in inner city Baltimore at Johns Hopkins. I did child and adolescent psychiatry, saw a little less addiction there, but really started to focus on treating addiction for young people, young adults, families, and that's how I ended up at Hazleden-Betty Ford. So it's less of an inspirational personal story, and it's more, I've been touched by the mission.
What is the Betty Ford Youth Continuum?
Well, the Hazleden-Betty Ford Youth Continuum is a set of services. It's way beyond residential care. We do everything from prevention work in schools. For example, we're working with the state of West Virginia on prevention programming. We have prevention products in our publishing arm that are trained at various high schools that are not even substance use. They're general prevention programs. We have more acute treatment at the residential setting, outpatient setting, intensive outpatient setting. We have a number of different family services and a family program. And we have a children's workshop, a children's program that is very famous. And so when you think about all of those things that help
Is that the one Jerry Moe was involved in?
That's right.
I
That's
love
right.
Jerry
Our
Moe.
children's program.
Yes.
We're doing this interview right now in Denver, you and I, and Denver has a great clinic that does the children's program.
So important. The whole family dynamic is so important because, when people don't realize that, when the family gets sick together, they need to recover together. If a person does not go through a recovery program of their own, the dynamic shifts when that patient comes back home.
Yeah, absolutely. And we know that when family members are engaged in treatment, especially for young people, outcomes are better.
Mm-hmm.
And also the people adjacent to that young person, if they get some kind of care themselves, their quality of life also improves. And that matters a lot. And that's something that's not thought about a lot. We think about the individual going through treatment, but that parent, that sibling, the family members of that person getting treatment, they put their lives on hold. And there's a lot of confusion and answers they need. They have mental health issues. They need different kinds of support. And so it's been a fabulously rewarding program for us to grow and sustain.
You are a CEO. You're one of the suits. You're the top of the heap. Do you miss patient interaction?
I so miss patient interaction. Our mission's so great in that it's not what people think it is at all. You see so many success stories. Of course, there's tragedies, right? And there's things that we could do better, and so we're being very humble about it. But we publish our outcomes, and we have really good outcomes. And when you're a clinician, you get to be part of that community, that part of gratitude, all the essence of recovery that you all talk about. Just to be a part of that is just really special. So I miss it. But what I do is I kind of vicariously go to all of our medical units on our campus, and I just spin around in nurses' chairs and act like I'm doing a thing. And I do a few trainings here and there. I'm a motivational interviewing trainer as well. And so I was one of the first homegrown motivational interviewing trainers. It's something that we bring as an evidence-based practice. And so I do some trainings, and I'm technically still a doctor, not seeing patients right now, but I do miss it.
Yeah. You're also president of the Hazleden-Betty Ford Graduate School of Addiction Studies. What is that all about?
Currently, Kevin Doyle is now the CEO of the graduate school. Yeah, we had a thing with the Higher Learning Commission. We wanted to get their accreditation. And as a part of that, our graduate school is more autonomous, still connected to the whole, but more autonomous. And so Kevin does an excellent job of running that graduate school.
Tell me about the graduate school.
Well, the root of it really is in our 75-year history. I talked to one of our former CEOs, and he said, we always believed that we were more than a treatment center. We were a social reform movement, was the quote. Wow. And I love that. I love that because, as you know, we started in 1949 on a farm. And the farm was called Hazel's Den because it belonged to the Power family. They're a prominent family in the Twin Cities area. And one of the owners was Hazel, so they called it Hazel's Den. And that was the name, Hazleden. That's where it came from, on this farm. So to come out of a farm where there's no treatment and to now become what we are. And people ask, why do you do so many things? Why do you have publishing? Why do you do prevention? Why do you have family programs? Why do you have a graduate school? Why do you have a research center? We do it because we're more than a treatment entity. We are a social reform movement. So wherever we can advocate and make a difference in the recovery movement, and you know where you can make a tremendous difference? Showing the world that world-class clinicians can come out of a school and make a difference. That's why we have a graduate school.
That was a great vision of Dan Anderson. Dan and I talked about that years and years ago. It's come to fruition, and it keeps growing. You do so much. Talk about the advocacy role of Hazleden, and with alumni members and having people who are in recovery stand up, speak out about not only the disease, but the recovery process.
Yeah, there have been so many things behind the scenes, and advocacy takes many roles.
Yeah.
There's government relations, there's the advocacy in the recovery communities, there's putting a name and a face to things in a way that Mrs. Ford did. And we try to do it all. We can't speak into every single issue, but I'd say on all those facets, we cover a lot of ground. When there's been parity movements or bills going through Congress, we've been supporters of changes, thinking ahead about the recovery community and what's good for them. But we also think a lot about the brand and the stage that we can set for other people to breathe into their recovery experience. We think that's really important. And so when we think about advocacy, we think much broader than what's good for Hazleden-Betty Ford. We think about what our founders and the people who came before wanted, which was a society where people would be more free and would have greater dignity in talking about their recovery experiences. And so that's at the root of our advocacy. So we speak into so many different issues.
What are some of the changes and challenges that you see over the next 5 years in our field?
Man, there are a lot of challenges in healthcare. Inflation, workforce shortages, reimbursement, true parity in healthcare. There's a lot of challenges, but that's also what makes it special. It's a mission that is worthwhile because there are challenges. So we have an optimistic view about how we're going to go forward with those things, whether it's access, whether it's diversifying our banner and reaching communities that haven't been touched. There are challenges that abound, but that's what makes the mission special. And I have a great team of people who are locked in solving those problems.
What about the publishing arm? Everybody knows about Hazleden Books.
Yeah, our publishing arm is rapidly becoming digital because that's what
That's
people
where we're
consume.
going. Yeah.
And it gives such a great opportunity, right? Such a great opportunity. We're publishing the ASAM fourth criteria, and underneath that we have a digital platform for consumers, businesses, other people to consume all of the intellectual property we have, to amplify other people's intellectual property, to get information out there, to get good training out there. And so our publishing arm has evolved. We still do books, but there's a lot of a digital push. We're in the employer space. We're very concerned about employees. There's 9% of, I think, employees, people who are gainfully employed across America, have a substance use disorder. And another 9% of employees who are gainfully employed are in recovery. And another 1% are going through treatment. This doesn't even speak to the percent of people who have family members who are going through treatment. You're talking about easily a quarter of the workforce in America who are going through some journey in substance use disorder.
And each one of those directly affecting 4 or 5 others.
That's right. And so we're trying to use the publishing arm and our digital interface to make an impact with those employers. And we're doing a lot. We're doing a lot of training. And so there's a lot of different products, and it's evolved a lot, and it's allowed us to reach a lot more people.
Talk about research.
Well, research is the key, because one of the things that we want to do is to prove to the world that world-class care is possible. For substance use disorders and mental health, just like it is for any other health conditions. And so we publish our outcomes, we track our outcomes, we have really good fidelity and methods to our outcomes. And so that's what's really important and at the core. But we also do a lot of research with other entities. We completed a research trial that had a lot of things that I couldn't even explain to you as a physician, but it had to do with genetics and the brain, and which people might be more receptive to a medication called acamprosate, which is a medication we use for alcohol cravings. We do research with different kind of withdrawal devices. And so a lot of academic institutions want to do research with us. We partner with them because we are sitting on, if you think about it this way, one of the best data sets in the entire country for substance use disorders and mental health. And we are just really committed to mining that data. And the technology is getting more democratized, with AI and everything else. So you can see it. You can just see it, where there's this time where you can not wait for a research study, but just really mine the data to individualize care for what people might need at a particular point in their journey.
It's an exciting time.
It's super exciting.
Talk about the workforce shortage and burnout with the people who are in the field now. I mean, if people don't take care of themselves, we lose them.
Yeah. One of the keys to our workforce shortage has been our grad school. Our graduate school produces people who are capable of doing both mental health and substance use care. That's really important. And so we supply that out into society. And so I think we're part of the solution for dealing with workforce issues. The other part that is really important with the workforce is if we want to broaden our banner to a diverse community, we also have to have a diverse workforce. So for lots of reasons, we created alternate pathways and loan forgiveness programs in our grad school. So we are addressing the workforce shortages head on, and I think we're doing a really good job, and we have an advantage there. Burnout, I think, coming off the heels of the pandemic is a super important thing. I'm a physician. I know that feeling very well. And what's really important to remember is there's so many incredible missional moments when you work for a place like Hazleden-Betty Ford, so much gratitude, alumni reaching out to you, just so much good stuff. But people need to know how to deal with the other stuff. Those situations that don't go well, those conversations that keep you up at night, the things that you could have done better. It's that stuff. If people don't know how to handle that on a daily basis in healthcare, Because in healthcare, you see the best of humanity and you see a lot of ick. You see both. And you have to be able to deal with both. And so we try to give our employees the right tools. And it's far more sophisticated than PTO and a hobby. You really have to know how to fill your cup, how to reset on a daily basis. And so we emphasize that with our employees a lot. And, our turnover data, it's always a notch or two below the industry standard. And so I think we're onto something. We're not perfect. We can always improve, but we're onto something with our culture.
People often ask me, how do you find a good treatment center? What defines a good treatment center? And it's not the brick and mortar. It's not the, the view. It's not the swimming pool and all the amenities. It's the staff.
Yeah.
I tell people, find out how long the staff has been together. That will speak volumes. And it's just so important to have good staff, and Hazleton is famous for that.
Yeah, well, thank you. At our root, recovery is about connection and community.
Yeah.
When you have people who understand that and who've been through that, who have lived it, I think they're going to get better outcomes. And the people are more willing to connect with self-help groups, ongoing care and therapy, because they feel that sense of community and belonging. And I think that's what we do a really good job of, is we transition people who may have really intense detox needs or mental health issues, and then we plug them into and surround them with a community. And that's where a lot of the healing really happens.
Yeah. We had you on the show on Recovery Coast to Coast a while back from the audio from the White House, a marvelous event celebrating Mrs. Ford and her image on a postage stamp. Now, I go way back to when postage stamps were 18 cents and the National Council on Alcoholism fostered the first postage stamp. And I kept telling, in fact, our mutual friend Jeremiah Gardner, that, we need a stamp in this field to really put a mark on it. And so suddenly here is the Betty Ford stamp and an amazing event in the White House. Talk about that and what that meant to you individually and what it meant to the field.
Yeah, I think it's tremendous for the field.
Yeah.
If you think about what Mrs. Ford did for breast cancer and for addiction,
yeah,
when you think about it, it's almost kind of unfathomable, because she lived in a time when people didn't talk about things like breast cancer and addiction. And so she gave a face and a voice. And I think there were millions of Americans who, for the first time, felt seen and acknowledged because of her.
Yeah.
Putting her face as a face of recovery is so important. We've put so much emphasis on overdoses and whatnot, and there's so much more work that we need to do there. But that has, in some ways, reintroduced this kind of gawking at addiction as a problem in the worst parts of town and whatnot. And I think Mrs. Ford is a good counter to that. That yes, those problems exist, but guess what? People in recovery also look like this. People in recovery can also stand up and speak like this. And so we were so proud of that moment, because we want people to not pity us. We want people to join us. The
remarks of Susan Bale Ford, she's been on the program before, carrying on the work of her mother, amazing. And Dr. Jill Biden's comments were so poignant. I was blown away by it, honest to goodness.
Yeah, it was a surreal moment, and it was just something that I was excited going, and we were all excited going, and it was even cooler than that, just in that moment in history. Yeah, and Susan, just a wonderful board member, and beyond the platitudes and the who Mrs. Ford was externally, she's able to reconcile who she was as a mother and as a family member, and she brings such a humanity to her character, and does such a great job of bringing her legacy along. And Jill Biden, what a tremendous speaker she is. She did a wonderful job. Yeah. So it was a great moment for us. It was a great moment for our 75th, and it was a great moment for, I think, recovery.
It certainly was. How many facilities, the Betty Ford Foundation?
Yeah, we consolidated New York post-pandemic to one clinic, and so I think there's like 15 across the country. And so we're in a lot of different states. We do everything from children's programming to residential care, outpatient, and in between. We have thousands of outpatient slots, and there's more to do.
I believe that recovery is living proof.
Well, thank you. Yeah, we'll all do it together. We got a great team. We got a great board. Our alumni are getting engaged, and it takes a village, because it's really about the community.
And the adventure continues.
That's right.
Thank you, Dr. Lee.
Thank you.
Well, I hope you've enjoyed my conversation with Dr. Lee, the CEO of the Hazleden-Betty Ford Foundation. And I want to remind listeners of this podcast that if you would like to tell your story of recovery, regardless of the path you've chosen, and as long as you have been in continuous recovery for a year or more, do drop us a note at recoverycoasttocoast@comcast.net. Coming up next, insight from a legend, the great Dick Van Dyke. He'll share some great insight on personal recovery.
Alcohol is running your life. You want help, but can't take time away from work to get it. Where do you turn? Contact Sundown M Ranch. Sundown M Ranch outpatient programs have helped thousands recover from addiction without losing time on the job. Nationally recognized for innovative, effective, and affordable treatment programs, Sundown M Ranch will help you put your life back on track. Go to www.sundown.org to learn more.
And now, as promised, some inspirational thoughts from a guy in really long-term recovery, over 50 years, actor Dick Van Dyke, on putting recovery first.
The true motives of our actions, like the real pipes of an organ, are usually concealed, but the gilded and hollow pretext is pompously placed in the front for show. Charles Caleb Colton. Some of us have made many unsuccessful attempts to give up drinking, drugs, overeating, gambling. We tried hard to quit, but always ended up going back to our addictions. Our primary reason is that our motives for stopping were misdirected. We quit drinking because the doctor or judge told us we'd better quit. We stopped using drugs because we were afraid our boss or co-workers suspected something. We abstained from overeating to make ourselves more attractive to our spouse. We tried to quit gambling because we were on the verge of losing our family. All the while, we harbored secret reservations about staying stopped. We weren't yet completely willing to do whatever was necessary to stay clean and sober and abstinent. Our real motive was to get off the hook or back in someone's good graces. All that has changed. We've learned from our own experience, as well as the experience of others, that we can't successfully give up our addictions by trying to do so for somebody else. Today, there's no question in our minds that if we expect to have successful recoveries, freedom from dependency has to be our #1 priority for ourselves. Thought for today? You forsake lasting recovery if you try to quit for someone else's sake.
Well, that wraps up this edition of Recovery Coast to Coast, the national podcast. If you've enjoyed our podcast, do us a favor and please share it with at least one other person. You can find all of our podcasts at recoverycoasttocoast.org. And if you'd like to get in touch, we'd love to hear from you. Our email is recoverycoasttocoast@comcast.net. And please hit the subscribe or follow button. It's free, and you'll be notified the next time we publish a podcast. Remember, if you know someone who's experiencing problems with alcohol or any other drug, here's a 24-hour national helpline offering free information and confidential treatment referrals. Spanish-speaking individuals available as well. Pretty easy to remember. 1-800-622-HELP. And we encourage you to check out findsupport.gov. It's a website designed for individuals, families, and friends. It includes information on how to pay for treatment, including low-cost and, in some cases, free treatment options. Find healthcare support, how to help someone else, or find help for yourself. It's all in one place at findsupport.gov. And join us next time. For America's Voice for Recovery, Recovery Coast to Coast, the national podcast. And another shout out to our sponsoring organization, Sundown M Ranch, where recovery begins, sundown.org. I'm Neil Scott, reminding you to stay healthy, live in gratitude, and be kind to others. Remember, the bright side of addiction is recovery. Pass it on.